Hey everybody, it's Paula here coming on to share a good stretch that we have for our pecs and our front part of our shoulders here. Now, a lot of times most of us have the tendency just to stretch and work on the upper back because that's where we feel a lot of our pain or a lot of our symptoms at. But most of the time, it's not just the back. I would probably say 99.9% of the times it's not just the back. We have two sides of a coin is how I put it. And if we only treat one side of the coin, we're gonna get half the results. But if we treat the other side of the coin, we're gonna get a lot better results. And so especially if you work at a computer for a living, or you sit and crunch, or you're reading lots of books these days, and you're really bringing yourself forward, or you're on your cell phone a lot, it's really, really important for us to open ourselves back up and allow our shoulder blades to sit back on our backs rather than being pulled up and over. That winged scapula, if you've ever seen that, where people's shoulder blades kind of pull out, a lot of times that's because we're so tight in the front of our shoulder complex that our shoulder blades can't even rest down the back the way they're supposed to anymore. So opening up the chest can help with reducing that winged scapula or upper back tension. So I'm gonna show you two different versions. One of them, you can use a door frame at home. Most of us have door frames at home. And the other one, we're just gonna use a wall. So pick your poison, which one works for you. And we don't need any special tools or equipment for this stretch. We're just gonna use the door frame or the wall, depending on what we've got. So I'm gonna step back here. The first one we're gonna do is the doorway stretch. And so this doorway is ADA compliant, so it's a little bit wider than some doorways. And what we're gonna do here is I'm gonna use my forearms to rest by the wall. Now, if you don't have long arms like me, you might have to rest more of just your wrists on the door frame, not necessarily the whole forearms. And there's nothing wrong with that, just be mindful of how much pressure you're putting on your joints. You don't wanna be jamming your joints into the door frame. You wanna try to keep everything as loose and open as possible. So for this, we're gonna, like I said, we're gonna bring our shoulders or our forearms on the door if you're long like that. Otherwise, just put your arms like this, depending on what you've got going on. And if you like the stretch to go up, where you've got a little bit more angle and you're stretching more down into that sternal and the lower ribs area, or if you like to keep it down so that you're stretching more up into the clavicles. It depends on what works for you. Some days you might like them just straight across, some days you might like them down, and some days you might like them up. It really depends on where your body is that day. So, for some people, simply standing in a door frame with your shoulders apart like this is a stretch. And that's okay, that's where your body's at today. We don't need to. It's a good idea to respect and listen to your body. So if you feel a stretch going through here when you're doing this, without even moving, just being in the door frame, hang out like this. You can stretch for 5 to 15 seconds. If you want to make it an MFR stretch, we hang out for 3 minutes or longer. But if this isn't enough for you and you're in the door frame, you're just flush with the door frame and you're not feeling anything, that's where you would take one of your feet and you would lunge forward. And I don't mean tip your body forward because that can jam the top of your joints here. We want to put our one foot forward and lunge through. And that'll change the stretch from just having your arms. And so that's a good one, just kind of keep your chest open and just hang out like this. It's a really good way to combat that forward grounding that a lot of us do on a pretty regular basis. Now, and then step out and let your arms down. Some people might have numbness happen in your hands and in your arms when you do that stretch. Especially if you've been out there for a little bit longer and you have so much tension in your shoulders and your front pecs here, that numbness and tingling can be that we're just temporarily impacting the stuff going down our arms. Now, as long as you're not forcing it, as long as you slowly eased into it and you gave your body the space and time it needed, you're not doing any damage. Now, if you're jamming things or jarring things, you might be doing damage, so don't do it that much. But I experience hand and arm numbness quite frequently when I do stretches like that, and that's just me knowing that my body is being pulled and stretched right here, and that this is actually becoming too tight, that it's affecting my arms and my hands. And so I know that once I come out of the stretch and I move around a little bit, all the feeling returns and the blood flow gets back, and I'll have less issues with my hands going on when I'm reading a book in bed. So, and like I said, we're gonna go over just real quick the without the door frame. So I'm gonna actually shut the door for this one. And if you're doing this without a door frame, you would put your arm on the wall behind you. So put your arm on the arm behind you, then you would turn away from it. Depending on where you want your shoulder would depend on how far up the wall you can go. Now you probably, if you have really, really tight shoulders, you're not gonna be able to go all the way up here and turn because you just don't have that range of motion yet. With continual practice, slowly giving your body the space and time that it needs to keep on loosening up, you will be able to get that full range of motion back. So be easy with yourself, do it slow. Like I said, if we're doing it with just the wall, we would put our hand on the wall somewhere behind us, and then we would just turn away from it. So we turn our body away from that wall, depending on where we got going on. And then we would just ease into it. Hang out for 3 minutes or longer if you're doing a mouthwash release stretch. Otherwise, you can just do little short 5, 15, 20-second stretches, depending on what works for your body and your time frame. So thank you all for joining me, and have a great day.